Well, my grandson, how can you be here so early?
Uh, I'm going to apply for a job. My current job is not enough for my daily life.
Well, son, don't forget to take your lunch and breakfast. Focus on your work. Someday, God will know that you got a heart of gold.
Yes, Granddad, I will do my best. See you evening. I will take your favorite food for you.
Good luck, grandson.
Why the house is so dark? What is he doing? Oh, the door is not even locked. What's wrong with you, Grandpa? Wake up! Wake up!
I'm fine. I have just fainted out.
I will take you to the hospital.
No. It's just fine. I just have to take some rest. The hospital will not get my penny.
No, Grandpa. The life is more important than our money. You are my only grandfather. Believe me. Please, go to the hospital.
Do not waste your money on this kind of stuff. I am.
Grandpa!
How about the patient history?
80 years old man came with unconsciousness.
Okay, what about the vital sign?
The vital sign, body temperature, 98.7 Fahrenheit, respiratory rate, 20 breaths per minute, and pulse rate, 50 per minute, which is low. And then blood pressure, 100/70.
And what about the general appearance?
Oh, let me see. Head, ear, eye, nose, throat, normal. Heart, murmur sound, lung and abdomen, normal. No trauma.
Mu, treat him with IV fluid and admit him to Sinakarin Heart Center. And Todd, request test of CBC, blood gas, chemistry 7, EKG, and chest X-ray.
Yes, sir.
Good evening.
Who are you?
I'm a doctor who are responsible for your granddad.
Okay. Doctor, what about my granddad? How is he?
Your granddad has a prolapsed mitral valve. We have to do a valvectomy, or else he will be faint again and again, or even worse than that.
Doctor, but the cost is going to be unaffordable. I think I cannot handle that.
But current state of your granddad, the treatment is inevitable.
Professor Boom, he's awakened.
Granddad! Granddad, how do you feel now?
I feel better now. But I want to go home.
Granddad, the doctor tell that you have some kind of disease, but I cannot remember. You need to have a surgery.
I do not think that it is necessary. I feel better. I do not want to bother you.
Oh, Granddad.
Excuse me, may I do some physical examination?
Okay.
How was the patient?
He is stable now, but the result of the electrocardiogram is not appreciated.
Okay, I see. Mr. Temple, I'm your doctor.
Hello. I have heard that I have to undergo some operation.
Oh, it is a valvectomy. Because your condition is not good enough and it is going to get worse.
Yes, it is necessary. Do not worry. The money is not the problem. I have a few left.
Okay, fine. But doesn't it have any risk?
Yes, it does. It is about the prosthetic valve. It's going to be compatible with yours, and you may be infected by Staphylococcus epidermidis. By the way, the success rate is very high.
That's right. The surgeon is very professional, and you and your grandson do not have to worry.
And what about the complication? I have heard a lot of bad news, such as post-operative infection.
The normal plaque is Staphylococcus aureus, but our hospital has a good qualified protection.
But I have read some kind of journal about this microbe. I have read it from some journal. The name JJ?
Did you mean JSTOR? It is surgical site infection due to Staphylococcus aureus among elderly patients. Mortality, duration of hospitalization, and cost, isn't it, Professor?
Oh, yes, I have already read it.
Can I have some additional information?
Okay, if we talk about the risk of infection that caused the death of the elderly increased 2 times compared to younger adults, since the elderly have lower immunity.
For the post-operative recovery time increases 2.5 times because the healing of operative wound and prophylactic antibiotics.
The cost will be double since you have to stay in the hospital for a long time, and also the cost of the medication.
Apart from age, there are also additional factors such as diabetes, hypertension, and obesity.
But do not be afraid. Our hospital has so many protective procedures and the world-class standards.
So that Mr. Temple and Mr. Den, you do not have to be worried. We will do our best.
Oh, thank you so much. If the infection occur, the cost will be double, and there will be many complications.
It does not matter. I believe I can fly. I have faith with your golden hand. I will be better, grandson.
Yes, Granddad.
Oh, I have just noticed that you have financial problem. You may have to go to the Sinacarin Foundation. They can help you.
Thank you so much.
Never mind. Mu and Todd prepare the patient for the operation.
Yes. So if the patient is infected with Staphylococcus aureus, it is going to raise the risk of fatality, especially in elderly, right?
Yes, that's correct. Like in the journal, I am stunned when I know he read medical journal.
I've noticed that nowadays patients have prepared a lot before they come to see the doctor.
I have to put my heart more into it. Otherwise, I will be an old-fashioned.
Alright, let's prepare for the operation.
Okay, I will give him the prophylaxis and then I will come along.
Okay, fine. See you in the operating room.
See you.
When is this going to finish? It is almost 6 hours now. Oh, here he comes. Doctor, what is the result?
Sorry, the result of the operation is poor. There are many complications. I'm really sorry. The patient is going to die in 3 hours.
Really? He is going to die? Oh my God! My grandfather! Oh, but doctor, thank you so much for everything.
Never mind. Can you tell me what is the main cause of the fatality in this case?
I think it is the virulent factors of Staphylococcus aureus, such as toxic shock syndrome toxin 1, enzymes, and bacterial structures.
Okay, what do you think, Todd?
I think that boy is wrong. In my opinion, he was infected with Staphylococcus epidermidis.
No, you two are wrong. The cause of this case is quite